Hello, it's Dr. Daniel Cameron. Welcome again to a live Lyme Hangout. This happens to be the fifth Lyme Hangout that we've had. The first one was on cardiac disease. The second two were related to babesia and newborns and neonatal intensive care units. The fourth was on my concerns with post-treatment Lyme disease syndrome. I don't like the term. I don't like the fact that 3 weeks of antibiotics is all it takes to get considered as post-treatment Lyme disease syndrome. But nevertheless, there's research saying 3 weeks of antibiotics for an EM rash, people do rather poorly. And I have a private practice, and I'm not very happy if my patients end up remaining ill after 3 weeks of antibiotics. I like the opportunity to treat people for longer than 3 weeks. I might like to look for other infections in a tick. I like to work on outcomes, not just a 3-week out and that's it type protocol. But tonight, I'm here for the fifth Lyme Hangout. So for those of you who are watching it live, is that on the screen on my website, danielcameronmd.com, you'll see the screen. To the right of your screen, you'll see one of the articles from my book, Lyme Disease Takes on Medicine. And down below, there's comments. So feel free to write any comments. I'm going to try to get to whatever comments I can after I present the topic, dementia and Lyme disease. Now, when I started my career, I went to medical school, and within the first few weeks, I was at a conference, and I was fascinated by the challenges of geriatric medicine. There was someone who was a citizen who was in her 70s, Maggie Kuhn was there. There were other leaders, and I thought, this is my career. I love the challenges that the elderly face. I love taking on a career to work with the elderly. I went on for the next 10 years to finish medicine, finish residency, finish graduate school. I was an academic assistant professor of medicine and geriatrics, teaching geriatrics to medical students and taking care of Alzheimer's patients. I was on an Alzheimer's unit taking care of those types of patients. And so it's particularly important in my career to look back at that time and look at what happened in my education, because I was teaching these medical students about dementia. I was treating dementia. I was teaching reversible causes of dementia. It was a problem because most of the treatments for reversible dementia, like B12 deficiency, syphilis, thyroid problems, depression, were not that rewarding. So when I went into community practice, changed to Lyme disease. Lyme disease seemed to be just as fascinating, just as challenging, and affected all ages. I've always kept dementia in the back of my mind. I followed the dementia field. And so tonight, I was looking at my book, Lyme Disease Takes on Medicine, and I was reflecting on this book, and I realized that there were 3 cases in this book that were dementia cases that had reversible dementia that got better with treatment for antibiotics. And that's a blessing in medicine when you can find a way to get somebody better. Now, a good outcome is so important. So the first case that I wanted to present in the book is a case you might have heard about in the news already. So after reading about this case, I thought that I'd include it. It starts out in this book, case study, Kris Kristofferson's dementia was undiagnosed Lyme disease. For several years, legendary singer and songwriter Kris Kristofferson was believed to be suffering from Alzheimer's disease or dementia. However, the musician's memory problems were later identified as undiagnosed, untreated Lyme disease. Now, this is not the article I normally review are those from the published medical literature. This is from another source called the Rolling Stone. According to the story, in the June 6, 2016 issue of Rolling Stone, doctors have believed that the 79-year-old singer's increasingly debilitating memory loss was due to either Alzheimer's or due to dementia brought on by blows to the head from when he was a boxer, when he played football and rugby in his teens and early 20s. He reportedly could not remember what he was doing from one moment to the next, the magazine reports. Now, if it was a medical journal, there were probably more of the medical findings from the doctor, but it was nice how descriptive the Rolling Stone article was. For 10 years, Kristofferson was treated unsuccessfully for Alzheimer's disease. Now, as you know, from Alzheimer's and dementia, there aren't that many great treatments. There's Namenda and Aricept. And even Namenda and Aricept often are not as helpful. They might prevent you from going to a nursing home. They might delay some severe cases, but they're not very rewarding. So after he was diagnosed and treated for Lyme disease, his life changed. Kristofferson's wife, Lisa, explained that once her husband stopped taking medicine for Alzheimer's and depression and underwent 3 weeks of treatment for Lyme disease, his memory and mood were shocking. All of a sudden, he was back. Now, that's a pretty common situation in dementia, for them to be treated for Alzheimer's and depression. In this case, the antibiotic turned it around. There are still bad days, but some days he's perfectly normal, and it's easy to forget that he is even battling anything, she told Rolling Stone. So this is an article, I'm not sure if it'll make it in the medical journal, but it certainly captures what we all want in medicine, is to get better. Now, the next two cases that are in my book, I'm going to talk about also. That I wrote here that this was a case study, 2 more patients with reversible Lyme disease dementia. This was about the Washington Post reported in June 6, 2016, that an 81-year-old retired case officer from the Defense Intelligence Agency who had survived leukemia was now told he had dementia. He was later diagnosed with Lyme meningoencephalitis. So he went from one life-threatening problem, leukemia. Then he had dementia, which, I know people can end up with dementia from a variety of causes. But the fact that he was diagnosed with Lyme was rather helpful. It showed the doctors used insight to look beyond the leukemia, beyond the dementia, to a reversible problem. Doctors had believed the man was suffering from a rapidly progressive and fatal dementia, probably a particularly aggressive form of Alzheimer's, writes the Washington Post reporter Sandra Boodman. He became moody, confused, delusional, childish, a jarring contrast with his even-keeled, highly competent person he had been. He developed tremors in his arm, had trouble walking, and became incontinent. So that's often happens in practice. But the doctors went further. After testing positive for Lyme disease, the man began antibiotic treatment and ultimately made a recovery. So that second case reminds us that Lyme disease can certainly give troubles. And the third case that's in my book was discussed in a Journal of the Neurologic Sciences. A 75-year-old woman had been admitted to a hospital in Austria with malaise, which is tiredness, abdominal discomfort, nausea, and constipation. She had a 10-month cognitive decline. Now, 10 months is quite a while. She had low mood, loss of orientation to time, as well as impaired attention, concentration, and short-term memory. Her exam revealed a marked slowing of speech, movement issues, word-finding difficulties, rigor and bradykinesia. So rigor and bradykinesia reminds you of a Parkinsonian type thing. It's a little bit like Parkinson's. Unsteady, broad-based, short-step gait, forward flex trunk posture, which is sometimes seen in normal pressure hydrocephalus. That's a situation where there's too much pressure in the brain, and that can lead to dementia. Mildly painful nuchal rigidity, which is the neck, no photophobia, and they have these dementia tests that are talked about. The one I was used to is one they used, mini mental state examination. The score was 20 out of 30. Remember, she wasn't oriented to her name, rather, she wasn't oriented to time. And she had attention and concentration problems. An MRI showed paraventricular white matter changes, widening of the ventricles. And that's where they said it might be normal pressure hydrocephalus based on the brain MRI. So they were considering dementia, normal pressure hydrocephalus. She had other medical problems, which anyone who's gets older accumulates. So she had depression, anxiety, headaches, musculoskeletal pain, head trauma from a motor vehicle accident 33 months before. But once again, doctors are thinking out of the box. Instead of calling it long-standing drug treatment for depression, anxiety, or normal pressure hydrocephalus, they found that Lyme disease was present in the spinal tap. That the findings were consistent with Lyme neuroborreliosis, that is, Lyme in the brain. The spinal tap had predominantly lymphocytic pleocytosis. That means a bunch of lymphocytes type cells in the spinal fluid, elevated protein, oligogonal bands, and highly positive brain serum antibodies compared to the blood. Now, you notice they had oligogonal bands, which used to be considered a multiple sclerosis finding, but has shown up in a number of other situations, including, in this case, Lyme disease. So late Lyme neuroborreliosis was diagnosed according to current European guidelines, point out the authors. The woman improved with 3 weeks of intravenous ceftriaxone, and after completion of that antibiotic therapy, her mini mental status score rose from 20 to 28 out of 30. And all the neurologic signs, the movement issues disappeared, the spinal tap was repeated and had cleared, and the patient remained well for 15 months. So in conclusion, I wrote that such stories and case reports remind us of the importance of considering Lyme disease as another cause of dementia and one that's reversible. So if I look back to my career and my interest in geriatrics, then I drifted to Lyme. I was seeing cognitive problems in my Lyme patients. Those first 3 patients that I saw in 1987, drifted over 1988. I saw cognitive problems, sleep problems, a number of other symptoms. And even though I was seeing those, there's a group led by Legigian, which also included Dr. Steer, who wrote an article in 1990 called Chronic Neurologic Lyme. So not only was I seeing cognitive problems, sleep problems, and mood problems, so was the group that included Dr. Alan Steer. That was published in the New England Journal of Medicine. As an internist and an epidemiologist, for the next 30 years, I've been seeing these issues, taking care of these issues. And I can understand how easy it is to take patients who have memory problems, concentration, processing issues, frequent sleep interruptions, fatigue, and various mood issues, lightheadedness, pain, and come to the conclusion maybe that's dementia. And if they're sick enough, it's logical to be considering dementia. But my experience in the New England Journal of Medicine has been that some of these patients are worth a second look. So when I was teaching medical students myself, I didn't include Lyme disease in the differential because I hadn't heard of Lyme disease yet. It hadn't come up in my medical education at the University of Minnesota. It hadn't come up in my residency at Beth Israel Medical Center or at Mount Sinai. But being immersed in an area where Lyme disease was so prevalent, Lyme disease hit Lyme, Connecticut, and hit my area in New York so heavily that I was seeing so many patients with the same problems that I might have thought about dementia in the past. So that's why I thought it's interesting where my early career when I was young to where I am now, where not as young, come together. And I'd like to remind patients that, yes, I might not have included Lyme as a cause of reversible dementia, but now I include it whenever I see a geriatric patient who's been having memory problems or concentration problems. I always want to not jump to dementia so quick and so early in when I'm taking care of somebody. If I look at my cases, it's not gonna that I'm gonna get them all right all the time. I always have to do a big dementia workup anyway. I include a neurologist, rheumatologist, or whatever specialist it takes. I might have to see a psychiatrist, but in any case, just making sure that I include Lyme disease in the differential offers me treatment options. Now, when I look at how to diagnose Lyme, it's it takes a while. It takes a careful, thoughtful interview. It helps to have family present. It helps to have friends give their observations. But Lyme disease can take months and years to develop, and it isn't diagnosed in a timely manner for many. I might get some of the more complicated cases because I've been around for a while, but dementia takes a while to develop also. So don't wait for months and years. Is that if you see memory problems, concentration problems, irritability, or a wide range of symptoms, start looking at Lyme disease as one of the possibilities and keep it open. What I like to do is go into more of the question answer format of the program. Now, just to remind you, for those who have come late, is that I'm Dr. Daniel Cameron. I practice in Mount Kisco, New York. I've been practicing for over 30 years, treating Lyme. I find that when I finish my work, I often find myself reading medical articles, reading the literature. I've taken to reviewing critically new articles as they've come out. I started a All Things Lyme blog to understand these articles. I've shared those on my website. I took the first 150 of the blogs, and that's where this book, Lyme Disease Takes on Medicine, came from. But it's a little different book. It really looks very carefully at how we got to this spot. How did Lyme disease come around? How did Lyme disease give medicine so much trouble? How did it divide medicine and doctors one against another at times? Or at least that's what it seems. And so still, I wanted to bring people that I've taken care of as patients, people that I might never get a chance to meet, and anyone who's interested into my home to look at some of these articles, look at the articles that are in this book, and get to know various topics from more of the scientific curiosity standpoint, just to get to know the topics well. So these live hangouts will be archived in this website, Daniel Cameron MD, as well as in YouTube. So this format will change over time. The current format is to have people write in, have my, all of you that are out there to write in so I can take on whatever questions I can address during this time frame. So if I look at some of the questions, I'm going to read you the questions that are coming up. And feel free to ask some more questions. The first question is, hello, Dr. Cameron. I appreciate your knowledge and experience in Lyme. As many others, my question is, although I'm fairly well versed as a Lyme advocate, I'm not embarrassed to say I don't know everything. Well, I don't know anybody that's got it down. Even the best scientists that I know are only working on pieces of the topic. So what is the one strain of Borrelia burgdorferi that is a true BB strain? Is the 31 the actual or the designer strain? So what we're finding is that there's a lot of strains of Lyme. Then there's a lot of co-infection, which are related to Lyme only in that they're in the same mouse, they're in the same tick. They all cause different illnesses, they lead to different symptoms. So it's hard to tell which strain is the worst one. These 31 bands are different proteins that are on a spirochete. And so I really haven't a good idea on which bands are important with which disease. There are scientists who try to find out which is the worst one. I just think that if you're sick with a tick-borne illness, you're finding yourself not responding to 3 weeks of antibiotics, just be aware that you can't be sure which strain you have or which co-infection you have. You also might have Babesia, which is a parasite. That doesn't even respond to antibiotics. It requires a parasite treatment. The second one, my client is being treated for Lyme, heavy metals, mold, has severe peripheral neuropathy, had stage 1 kidney cancer with partial removal of the kidney. His doctor said they noted cognitive issues, muscle loss, which is the sarcopenia they're talking about. Now, what diet eating strategy is best? Now, in this questionnaire has to do with beyond antibiotics. Are there alternative medicines, alternative ways of looking at your health than just antibiotics? I can tell you that because this individual has peripheral neuropathy, that is something's wrong with the nerve. That is seen in chronic neurologic Lyme. And it may turn out that treatment for chronic neurologic Lyme could include intravenous ceftriaxone. And that means that we're not completely sure that antibiotics have worked or antibiotics have completed the infection. This questionnaire has to do with the alternative medicine, sometimes naturopathic or integrative medicine, naturopaths, where they're trying to look at a broad range of stimulus to the immune system. And so I usually refer these to the allied professionals to try to see if there's a role for them. I find there's so much I could do with an antibiotic, staying away from sugar, staying away from alcohol, exercising, that I find that that I don't need to focus on those for now when I have colleagues in my area that can add these things. I'm not at all happy because the research for these other things like heavy metals and mold are still in their infancy. They make Lyme disease seem like they're in the forefront. What are your thoughts on using stem cells to help the body respond to and repair? Now, I'm also frustrated with stem cells because there's a lot of people starting stem cells from various tissues that they have, but it's very hard to find any good materials, good scientific evidence as to who's going to benefit, which patient is going to benefit, and who's going to pay a price for side effects. And so that's why, as aggressive as I am with treating Lyme, there's still some things that I haven't adopted. Some of my patients still seek out stem cell therapy. So one of the natures of doing a question answer is that anything goes in terms of questions. The next one is, hi, Dr. Cameron. I have been treated for Lyme and Bartonella. Just wondering, as I've gotten through various treatments, I developed POTS. I took a further treatment of antibiotics, and the aversion to standing, as well as overreaction to standing in terms of heart, stopped. As the POTS symptoms wane, I now have one leg that swells, one arm and hand where the nerves don't work so great. The compression hose is a limited effect. So POTS is a situation where your immune system it's affected not by the sensory system, which is sense of touch and heat and smell. It's not the motor, which is how you function with your muscles, but it's more like the adrenaline, the cytokines, chemokines, or various chemicals that you need to sort of keep balance. So POT stands for positional orthostatic tachycardia syndrome. If you stand up and get lightheaded or have trouble standing up without getting lightheaded, is that POTS is increasingly seen in Lyme disease patients. So people go to cardiologists, neurologists to treat POTS, but many of them come to my practice and practices like mine because POTS is one of the dimensions of a tick-borne practice. Now, having a swollen leg and hand, it's possible it's related to nerve issues from Lyme, but it's a good reminder that as we look at Lyme, it's important to involve a number of specialists to make sure that we're not dealing with some kind of infection, some kind of vascular problem, maybe even a mass in the thigh that's interfering with circulation in the leg. So that's something that's very important. I always make sure that they see doctors along with myself to make sure there's no other cause of a problem. Can you explain the difference between brain fog, dementia, and cognitive damage? Now, the English language is a little slow. Often they don't come up with names quick enough. And so patients with Lyme were often telling their doctors they had poor concentration, they couldn't process information, they couldn't find the words fast enough. The facts weren't coming up so quick. Even when they drive, once in a while you'd see somebody driving a familiar route and they would have a few moments of doubt as to where they were driving. So a lot of Lyme patients would refer to it as brain fog. And there were some specialists who said brain fog in quotes, except that the dementia, not dementia, but the fibromyalgia community, the lupus community, we're also seeing concentration processing issues. So you'll see a lot of literature on fibrofog, lupus fog, but I think it's a language that patients communicate to each other where they can't concentrate so well. Cognitive damage and dementia are overlapping terms. People in the field of dementia are never sure that transition from memory problems to dementia. So often you'll see doctors who are in dementia and Alzheimer's hedging their bet. So they'll call it cognitive impairment, cognitive deficits, without committing to dementia. So cognitive damage is more of what you're seeing, what you're witnessing, what affects the function. And dementia is if someone wants to call it by a particular name. But I found when I was in geriatrics that it's very tricky to predict the future in someone that had early dementia. And now that I've gotten into my practice for so many years, I can see where reversible causes of dementia, like depression, in this case Lyme, makes it still unclear whenever you have early cognitive issues, moderate cognitive issues, what are the issues? And are we sure it's dementia? I think this live hangout is just to remind us that be aware, follow people, always look and see if there's a reversible problem. Next one is Dan. Have you diagnosed Lyme patients along with Lewy body dementia? What were the symptoms you used to determine this? My late husband's brain biopsy performed by Dr. McDonald showed Lyme, Lewy bodies, filarial nematodes, and the second autopsy shows Bartonella. What happens is that when somebody has dementia or a cognitive problem or Alzheimer's or Lyme, is there's always an interest in what is actually happening in the brain. So when you see Lewy bodies or see other problems in the brain, is that you're trying to come up with a diagnosis. And Dr. McDonald has for years, as a pathologist, had an interest in what is actually happening in the brain. And so he's been pushing doctors to look a second time at the brain, try to find out what's in the brain. I hadn't read about the much about Bartonella in the brain, but that it's interesting that at least this notation says that it's nice to look a second time to see if there's any connection between tick-borne illnesses and cognitive problems, or tick-borne illnesses and dementia. Next one is, first of all, thank you much. I've had Lyme for 32 years. First 18 years went untreated. Now, the chronic neurologic Lyme article by Legigian and Steer, they were sick up to 14 years. So this is not unusual to be sick that long. My doctor forgot to tell me. Short story, several more exposures, and now alpha-gal from Lone Star tick. I am disabled, multiple chronic conditions, but lately my memory is getting more challenged. Any suggestions? So it's important to make sure that if a tick-borne is at least a possibility, that you make sure that there's no chance that a persistent infection is underlying the problem. What she's referring to as a Lone Star tick is a tick that's moved from Texas and is in our area in the Northeast. And there's some concerns that it gives a allergy to red meat. And so it's still a work in progress. I'm staying tuned. I'm reading quite a bit to see what the Lone Star tick's going to do. I'm also concerned with any kind of tick is, since they often eat a meal, they'll often bite a mouse, and I'm always afraid that there'll be mixing of different organisms, different infections in these ticks. Next one is, thank you. My 2 kids and husband have Lyme. They say that they're Lyme neutral now. However, I've seen Lyme fog in them as well. So there's some spelling there and there, but the most important thing is, just because we think of the elderly and we're thinking of geriatric issues, as you can get the same concentration problems, memory problems, focus in kids. And when you can't concentrate, that certainly messes up being able to attend school, participate in school. School often has a tendency to give you a lot of information, have you process it, and write a paper on Friday or take a test on Friday. And if you have this kind of fog issues, which patients refer to, or cognitive issues, which I refer to, it's very difficult. And you're not going to be calling a kid that's 15 having dementia, but the doctor might choose to call it ADHD or anxiety or bipolar or fibromyalgia, or they'll say it's a pain syndrome. But whatever they call it, remember, outcome's important no matter what you do. If it's a tick-borne, treat the tick-borne. But the most important things is that you stick with doctors who know these issues and try to keep a success in mind. Now it says here, my dad has Lyme as well and recently diagnosed with dementia. I think a second look is worthwhile. Now, dementia exists, and there's certainly people that are pretty bad, where it's not clear you can even communicate or understand what the symptoms are. But I find that my best success is, whether it's a teenager, young adult, to mom and dad, to look a second time at Lyme disease. Next one is, hello. In your experience, what has been the most successful treatment protocols for your patients? What do you think about herbal strategies? Well, I find that I work for where my strength is. I have been working for 31 years using one of three groups of drugs: doxycycline family, the amoxicillin ceptin family, and zithromax bioxin family. And just when I think I'm getting used to those three, Babesia came along as a parasite. And so I moved to treat Babesia with a parasite strategy consisting of Malarone and Zithromax. I moved to that much quicker than I've done in the past. No matter what I do, as I watch that diet, be careful with alcohol, careful with sugar. The herbal approaches, I'm sure the herbal people that do well, the chelation does well, but I find that just the straightforward, persistent infection theory works so well. Those who are having difficulties, they will sometimes add the herbal strategy, but unless I did the herbal, I don't really find that I can really give you a good feedback on what to do with the herbal medicine protocols. Now, I just refreshed the page and I realized that there's a few more questions that are popping up here. We are looking at autoimmune encephalitis or some sort of autoimmune problem. Have been treated for Lyme, but nothing seems to be working. Are there some Lyme doctors looking into autoimmune field related to psych, anxiety symptoms? Now, Lyme hits the immune system, so it fits the autoimmune type category. So, it's very important to work on autoimmune issues, see those who work with autoimmune issues. But if Lyme is a part of the issue, maybe it's not the whole issue, but part, I just want to make sure that Lyme doesn't get lost when someone goes off in the autoimmune direction. I'm not sure if there's any more room to go with Lyme disease, but it doesn't hurt to get a second chance. Every doctor does take a different approach to Lyme disease. Next one is, what is your opinion on the importance of removing root canals and cavitations? Well, I'm not taking teeth out or recommending that people take teeth out, but I'm still following it because there's some theories out that infections in a tick hide in the teeth, or that perhaps the mercury in the teeth is triggering the immune system to turn into a chronic illness. But I've been more watching myself. Some of my colleagues have different approaches with teeth. This one is, I was treated a year with antibiotics by you in 2014. If I had been co-infected with Ehrlichia and then experienced leg weakness, sweats, chills, photophobia, what you recommended. I'm an OR nurse who just wants to say competent and functional. My primary rheumatologist did not acknowledge my Lyme disease. Well, first case doctors don't all agree on tick-borne illnesses, but doctors don't always agree on any chronic illnesses. There's always a challenge. Most important things, whoever you're working with, is you want a good outcome. So here I have someone who had been working with me with PO antibiotics. It looks like oral antibiotics, and still having issues of leg weakness, sweats, chills, photophobia. Lyme creates problems, but Babesia creates sweats. Bartonella shows up in some people with who get a tick bite, have Lyme, and so it's Bartonella is a little bit complicated in that it's also seen in cats. But in any case, all doctors have challenges when someone's been still sick, and you wonder when you look back at this reader's question is there something else we can do? Is there something else some other illness that has emerged? And so I wish her well and trying to get better, because being better is the most important thing. So I think that, let me refresh the page. How do I get tested for POTS? POTS is often a descriptive. Getting up too quick, you get lightheaded. Standing in one place for too long and then moving, get lightheaded. There is a machine called the tilt table where they tilt you quickly, check your blood pressure, see if your blood pressure or pulse change quickly. Otherwise, it can be a clinical judgment. There's no blood test for it. Have you seen a known Babesia infection causing thyroid nodules? No, but thyroid nodules are common, so it's important to get both worked up, both evaluated. This then says, this is informative, so thankful to have a knowledgeable doctor answering questions. My family was treated with frequencies. What are your thoughts? Do you have experience with working with these? This has to do with the question of a theory that if you get like a Rife machine or some other electrical type of machine around you, that you might find a way to get better. I still haven't incorporated that into my practice, but some of my patients do. It's still hard to understand the range of the protocols that are being introduced. Here are some questions from YouTube that someone wrote here. I have a friend with Powassan and Lyme, and is in the early 40s and getting bad dementia. What treatments are there for Powassan? Well, Powassan is a virus, and there's no direct treatment for viruses, whether it's from Tick-Borne or something else. And so if somebody has evidence of Powassan, they should make sure that they don't have another Tick-Borne illnesses that's treatable. Once again, getting bad dementia means they must recognize the cognitive issues, the brain fog issues. Here's another question from my YouTube channel, because after all, the YouTube channel is recording what we're doing today. Dr. Alan Steer is treating patients who fail with 30 days of doxycycline, then fail IV Rocephin, then treat them with methotrexate TNP inhibitors. What do you think about these treatment strategies? My concern is that I don't want to have a situation where a persistent infection is the issue. So in this case, I don't know for sure what the doctor's protocols are, because every doctor uses some clinical judgment. I feel that I can't be sure a persistent infection is not an issue, and so I'm treating with one oral and one intravenous, and then saying, oh, the infection is gone, leaves some risk. If you're having to use methotrexate or tumor necrosis factor, that means you're working on suppressing the immune system, modifying the immune system. And I'm always worrying about getting in trouble with an immune response. I don't like to use steroids either. Steroids also suppress the immune system. So thanks for the comments on the YouTube channel. Let's see if I have any more. Thank you, everyone, for such a great range of questions. It doesn't mean I have the answers to everyone, but it's great to take a little bit of time. And you should also be aware that this format of talking about an issue, Dementia and Lyme, doing Q&A, is that the format will be subject to change as we try to figure out the right way to share time. When I try to figure out the right way to share time with you. Have your patients that were treated with antibiotics remained symptom-free for an extended time? Yes, there's just because I'm a champion for people who are still sick and who are still having problems, I have an awful lot of turnover. A lot of patients just happen to get better, stay better, don't need me anymore. Some of them will come back a year later, and many of them don't. So it's we're happy for anyone that gets better, and we're taking the great fight for those who are not doing well. So I think where we're at now in terms of tonight's program, can you see me now? Can you see me now? How about now? Can you hear me now? What? Okay, so I think I've lost everybody. Okay? Should I give up, honey? Okay, let's see. Okay, Dr. Cameron, I'm just working on being able to kind of pull everything together and see you. Can you see me now? Okay, here I'm back, and this is the technical glitches that come when I close my computer. It closed off the audio feed and visual feed, so I'm back, and I wanted to like pull this program together, and I could tell you that being able to leave my practice, read articles, write a book, and share my years of work in Lyme disease. This is a format that I'm enjoying. I'm enjoying my Instagram, Facebook, and I'm hoping to have newer formats as I come along. So I'm finding that the new social media seems to be allowing me to work with you all. You know, I've been working hard in Lyme. I get beat up when I treat Lyme sometimes. I try to write what I can. All the doctors find themselves divided, confused, but I'm finding more and more doctors are taking an interest in Lyme. So no matter whether you see me, see my colleagues, or see your doctor, is that no matter what workup you have for what disease that's out there, dementia is a great model for what seems like a logical disease, seems like a disease, but a second look is worth pursuing. So I'm going to close now officially. This time I'm not going to close my computer. I'm going to have anybody that might have missed it check us on my website, Daniel Kahneman MD. Check my YouTube channel. You can look at the bottom of the Daniel Kahneman MD to see how to connect to the social media. So remember, you hang in there. Those who have Lyme, hang in there. Those of you who are supporting others who are sick, work with them. They may not even know they're sick. They don't have the cognitive capacity. They can't process information. They may have an inability to find the insight to understand how sick they are. But be their champion. If they're sick, remember, outcome's important. So thank you very much for joining me. Thank you for putting up with the technical glitch. I'm learning as I go along, and have a good evening.